Well, my name is Sal McKeel. I am director of the pediatric, we don't have to say that anymore, hematology oncology program at Children's Hospital of San Antonio. And I have had a great opportunity to work with Jana and T-Bone for probably getting close to 10 years, I would say. And we have had a fantastic relationship. The hospital have strived to provide comprehensive care to all of kids throughout the hospital. And my responsibility in particular is a hematology oncology program. And, this is one area where I think that if you have not had an experience with this type of illness, cancer is devastating to the family. And this is a child with leukemia. The treatment can last up to 3 years. And it's not just a doctor or a nurse can just care for this child. It requires an entire team of case managers, social workers, psychologists, along with many other specialists, infectious disease, surgeons, and so on. Hospital stay can be lengthy. After that, frequent visits to the clinics. And we don't just see, our patient populations are not just from San Antonio. We see children from all over South Texas, all the way probably Fort Davis, El Paso, Texas, down the valley, Corpus Christi, and so on. So when the child gets cancer or any type of similar illnesses, parents usually, one would have to quit working to care full-time for the child because, it's 2-3 visits to the clinic, sometimes 4 or 5 hospital stay. It's very difficult for both parents to continue to work. The situation worsens if already a single parent who has to deal with this type. So how does T-OFF work for us? T-OFF has been great. Jenna and T-Bone has spent many hours to allow me to have fund available to assist the family. We started small, and we have evolved into something of a huge program. We have we purchase a fridge for our family when we need to. We bought air conditioning for our family when we need to, using the fund that's available to us through our Children's Hospital Foundation. We utilize, sometimes people like us don't think about it, but after you have to pay your copay for 6 months, and you don't work, or you can only work part-time, even a $5 parking can become very difficult to pay. I know for a fact sometimes our parents really just want a soda to drink, and really they are tight. So we have fund available from T-Bones and Jenna, and we can do this by using a gift card or a food card for the hospital. They need gas, we have gas.
Let me just ask you, because hearing you, it's obvious it means a lot to you. But what does it mean to you when you witness what these little things mean to the parents that are going through that? And when you talk that way.
Well, it means a lot. For me, and I've been doing this for a long time. This is my 32 years at the hospital. It's very difficult for me to not able to help our families when we need to, but it's rewarding to be able to. And I work a lot really behind the scene. The social service team are the one really at the forefront of this, and they'll come to me. It's extremely rewarding that I know I can help the family, When, for instance, if our case manager called me up and said, it's Friday afternoon and we can't get the insurance to approve this medicine and we're going to need $125. And I can say, take the Visa cards out and go ahead and pay for the family. Let's get the medicine. We don't want to wait until Monday. We want to get it going. That in itself, it's rewarding because there's one more treatment that we can extend. I would say just our mission of the hospital, we are not for profit, and our mission is to extend the healing hand of Jesus Christ, and that is in the way we are able to do that, extend our hand out to be able to care for these children. Some of the things we have gotten, maybe it's minor, a little video game or a laptop and things like that. And I have to tell you that it is extremely emotional to me when we bring in new things and kids really enjoy it, or parents come up and say, thank you so much for this and that. I mean, I see them, they don't say directly to me because frankly, they really don't know who I am anymore. Our case management team, our social, the one to deal with those. And it's great because you extend the time for them to be able to spend with taking care of the child rather than having to worry about how I'm going to pay for that medicine, how am I going to pay for that parking for the week. It just, like I said again, for what you and I have, that a lot of time we have taken for granted, it becomes so much more magnifying. It's so much bigger to other people who are experiencing a tough time, acute illness, just terrible. Cancer in kids are just terrible. Even though we've made so much progress than when I started doing this, our survival rate is in the vicinity of 80%, 82%. It's fantastic. So, but it's not. Still not there. The best would be we can stop it altogether. Put me out of business. I'm willing to go work for T-Bone because he doesn't really do anything according to him. So, but
we can edit that. Although everyone will be able to relate to that.
So one of the things that really great is this Hope bag that Jenna came up with maybe 4 years ago. 3-4 years ago, and this is a bag that has everything in it. A lot of times we fly our kid in from somewhere, or they come through transport by ground, and mom or dad or both of them a lot of times didn't have a chance to prep themselves ready to go because they'll be at the doctor or an emergency room, and the next thing they say, you got to go to children's hospital. And so they're here. So this whole bag has a lot of emergency items that's very useful to them. Anything from dishwasher, soap, liquid soap, blanket, snacks, and then on top of that, there's a $50 Valero cards in there, and it's $50 HEB cards on there. So, for instance, if they have to stay off-site, they can go and buy food.
Hold on 1 second. With that.
Yeah.
Oh, yeah. So now you messed me up.
You're doing awesome.
But you'll be heard a lot clearer.
Awesome. There's multiple.
Oh, man.
One of the interesting things that both moms that we interviewed said was, it's those little things that you don't even think about. You're sure. Thinking, my kid is sick. Mm-hmm. I'm going to do everything in my power, physically and spiritually, and that you give them a bag. This is a bag, blah blah blah, and they don't even think about it. But at some point, they realize I haven't brushed my teeth in 2 days, or I need to wash my clothes. They start looking in that bag, and it's like the magic.
Right.
It's like these little items.
Well, and I liked what Victoria said the last, she said, she could feel the love in the bag. That's
You must experience that firsthand.
Yes, I think that So, continue on, shall we?
Sure.
Yes.
So yes, the bag provide a lot of caring, consideration, and love. Someone put a lot of love into it. That taking their time, putting all of that stuff in there, and yes, every little thing counts. Enough money to buy a can of soda, to be able to fill up gasoline and drive back home because they have 2 other kids at home with the neighbor. The situations are just unbelievable. After 32 years, I can probably write a big book of, how difficult it is, what they have to go through, what hardship our parents have to go through. And I'm not saying that adults don't have to go through something similar to that. I'm sure they do. But to be selfish about it, this is our program. This is our children's hospital. We are not for profit. We're here to take care of children, sick children, and they are my priority.
And how exciting is it that we have the first freestanding children's hospital in San Antonio, and how necessary is that for a city this size to have a whole hospital totally devoted to that? Can you talk just a tiny bit about that?
Sure. And one of the things that I think most people in San Antonio or the surrounding area don't understand is the importance of having a standalone children's hospital, academically oriented hospital. Why is that important? Because prior to this, a lot of subspecialists are not locating in the same area. We have such thing as parents have to drive to Houston to see certain specialists and so on, at Austin. A lot of that is no longer the case because we have the specialists here. To be able to provide the care by the staff who only care for children. Our nurses are all pediatric trained, all the technicians, such respiratory therapists, X-ray technicians, and so on. These guys are kids friendly. They understand how a 5-year-old think, or a 17-year-old, right? So that's one thing. The other thing is, when you become a freestanding children's hospital, especially partnering with Baylor College of Medicine, the advantages here is that we have been able to credit this to our pediatrician in chief, Dr. Mark Gilker. We have been able to recruit great physicians. I think at the current level of the number of physicians, I believe we have 175 specialists and subspecialists with us, and that's more than ever before. We have such Dr. Tim Griffin, who is our section chief, has done a tremendous job at recruited all of these hematologists, oncologists to be part of our team, and that probably an area where a lot of people don't understand. When you become academically oriented and freestanding children's hospital, we are able to recruit top-notch physicians and specialists. We can start research program. Our own hematology oncology program have 35 open research protocols that we actively working through, enroll lots of kids on that. So that's some of the things. And really, it's a convenience of be able to bring So parents from all over San Antonio and surrounding area can just come here and bring the child in to be seen, by anything from oncology problem, pulmonology, allergy, you name it, we have those guys. Rheumatology was really, really bad because pediatric rheumatologists are really hard to come by. We had one physician that saw lots of patients. He was so busy, his referral time is like 3-4 months out. And so Dr. Gilger was able to recruit another physician on. And so he is the only board certified pediatrics only physicians. So there are like 300 of them in the country, and we have one. And that's one of the advantages of having a freestanding children's hospital. So we are able to recruit, a physician of that magnitude to be able to work with that. Dr. Tim Griffin, for instance, my section chief, he huge experience administratively and as a physician, as a specialist. Our team's all board certified hematologist oncologists. Physical therapy, we have that available for our kids. And then, of course, the exciting news is our bone marrow transplant program. To complete a HEMOC program, we must have a bone marrow transplant program. And that will be, by the time we speak in person at TR for cancer this year, that program will have begun and transplant, hopefully, a few kids. So, but, it's very touching, the relationship I've had with TR for cancer. There was so much I would not have been able to do. And now, for the past 4, 5, 6, 7 years, I lost count now, we've been able to do a lot. Like I said, the $15 monthly parking, maybe $15 we spend at McDonald's or Chick-fil-A, for some of my parents, it's difficult at times. Sometimes just to buy dinner downstairs in the cafeteria is difficult. Pay for gas and so on. Or $125 co-pay on Friday afternoon. We would not have been able to do that without you guys. The playroom, my new playroom, our new playroom in the clinic, tremendous. The playground that TR for Cancer has sponsored and we were able to put in and able to come back after the construction. It's huge. Everything has been for our children. And I would ask that to tell you that the money is for really good use, and we are a good stewardship of the money. We certainly do not just spend it for a fact of spending. I'm sure if you approach T-Bone, he will tell you that I'm actually pretty tight about it. I don't spend the money unless I have to. He's constantly telling me, what do you want? What do you want? And I would say, no, I don't want that. I want to wait until I really need to spend the money, and I will spend the money. And that's my attitude, because all the money that's being given to TR for Cancer and come to me, that's a hard-earned money from someone. And it's money that someone wanted to really be utilized for our kids at the hospital.
Well, I think one of the things that we've been successful is really having a direct impact on a patient versus, someone's donation that goes into, and nothing against American Cancer Society or whatever, but if
Sure.
you give $100 to them, who knows how much is that really going to help someone? And it does, but it might
Right.
be indirectly. Someone gives $100 for us, or say to sponsor Hope Bag, I think it really impacts them immediately. Like
Sure.
I said, whether it's the parking, a food voucher, whatever. I mean, I think that's why we've been successful, is because people can see that.
Yes.
Donors can see, oh wow,
Sure.
okay, if I'm going to give $100, that $100 is actually a patient is going to see it,
Yes.
or a parent. So.
And that's important to us as the frontline people who are actually caring for these children and families. So we have asset that we can access in a timely manner. So we don't have to go through 2-3 days of requesting or 4 days. So if I need a microwave for someone, we can grab the Visa cards and run off and buy or give it to the family or buy it over the phone and they can pick it up. That ability is probably the best thing for us. It has been extremely helpful to be able to just reach over and say, and we keep track of how we spend, which patient we give the money to, and for what reason we do that. That's.
Well, I think what most people don't understand is the extreme crisis that you are in when your child gets diagnosed. And I think every parent can relate to that, but until you've actually experienced it, it takes over your life. I know as an adult how it became my full-time job. I can't imagine if it was my child, and then having to work also or whatever. So, I think us as a team, have been good at being able to just maybe take the edge off a tiny bit, with, saying here's some stuff to help you, like you were saying, brush your teeth, or, just when you're just been, told your kids, you're in for the battle of your life,
Yes.
So y'all are the heroes for sure for dealing with those patients every day, because I've told you that before, I don't know how y'all do it, because it's it's not always happy. It's not always happy news, and it's a sucky thing that they're going through, for sure.
Well, I think what we do is difficult, but it would have been much harder without the resources that you have made available for us. Maybe you feel like it's very little, but to us it's a lot. And I think that our team always have the good understanding of how we utilize our resources and be a good steward of what we have. But you will never understand the Friday afternoon when I'm driving home and they call me and they say, I need $250. This patient gotta have this medicine and the insurance won't approve until Monday, and pharmacy they have it in stock, they can give it to us, but we need $250. What do I do? And as a director sitting behind the scene, it is a fantastic pleasure to be able to say, go ahead, Susan, just get the card out and just do it. They need the medicine.
Awesome.
Even though I would never see mom's face, but Susan will come back and say they really appreciate it. They were excited that they were able to get the medicine that they need. So, again, I think many of your donors would I have met and personally thank them. I don't think they understand how much they have touched us and our families. But personally, every time I meet one of the donors, I don't know what else to say to them without going over for 15 minutes and explain all of that, except thank you for what you do for us. And I just feel like, they probably feel good because I said thank you, but I don't think they really understand the magnitude of my thank you. There's a thank you and there's a thank you. And my always huge, just like when I tell you, every afternoon after the golf tournament and you're sitting there and I know you're tired, and you still got stuff to do, and I come up to you and say every year, thank you so much for doing all of this. And you have no idea how much I appreciate that. Because
It's a mutual admiration.
this piece is so important to me, and you guys are important to me.
Oh, thank you.
Thank you.
And we feel the same. And I think you did awesome.
Well, thank you.
I think you're amazing, and I appreciate you taking the time to
No problem.
talk to
Thank
us,
you.
But it was perfect.
Thank you.
Just what we needed.
Okay, I'm trying not to drop this section.
Oh, he did amazing.
Extremely well.
They said T-bone, Thank you, sir.
Thank you
Thank
very
you for
much.
taking time to come and
Oh, thank you.
Thank you so much.
Thank you for all you do.
Did you get nervous?